this is normal. I mean, sex is common. Most of us, unless you're called to celibacy, will be having sex. So this is something that most of us will face at some point in our life if we haven't already. So this is also a very common topic that most of us are dealing with individually, but also like we as physicians are commonly deal with this every single day. So it's not unusual if you bring it up. So.
Okay, there's another question.
I had a feeling.
do you experience partners complaining about sexual abuse in your practice?
Yes.
Percentage wise, or can you just elaborate on that?
I don't have a percentage, but I have encountered patients who feel really disempowered in their relationships and really feeling like they are not necessarily having sex when they want to have sex.
Okay.
Yeah. I have had patients that have maybe victims of sexual assault as well, but I have patients that have expressed even in their active relationships where they might be feeling coerced to have sex when they don't want to have sex, which I also consider a form of sexual abuse.
Yes.
Yeah. So I have experienced that in my practice. I would say the most common type of abuse that I've seen is more the verbal abuse. The verbal and physical, unfortunately, I've seen both, but then I've also seen financial, also as it relates to elderly, like the caregiving, like kind of being concerned about like big kind of money being taken and that kind of. So I have seen most forms of abuse, and there are ways that I oftentimes will give patients the CT Safe Connect resource, which is our kind of Connecticut statewide domestic violence hotline. And then if I'm concerned about elder abuse or of course child abuse, there's I'm a mandated reporter. So there are reporting hotlines that I would report to so that can be investigated. But yeah, unfortunately these things do come up. Yeah.
Interesting. Yes. I've gotten that quite a bit, that persons are being harassed and accused for not wanting to participate in sex as often as the abuser would like, and then I have situations where I had this one client that feel as though her partner wasn't having sex as much as she would like. And so it's a thing where it goes back to conversation and communicating about the needs and how you're feeling. And I believe the door should be left open that your partner can express how they are feeling. And I know sometimes it can be a hard conversation, but the opportunity should be given, and you should allow the person to express how they're feeling.
Absolutely.
Yes.
So. And I've seen that too, where it may not be abuse per se, but there's a difference in satisfaction in sex in couples. And I ask those questions. So that whenever I kind of go through my physical, I do ask them about sexual function and satisfaction. Sometimes they might say, oh, sometimes they might be dealing with decreased libido. Maybe they're going through menopause and their desire for sex is decreased. Maybe they might be experiencing vaginal dryness. Maybe for a man, they might be having ejaculatory issues or erectile dysfunction. So I do talk about it, and I do encourage, particularly because unfortunately it can be challenging there isn't a specific treatment for libido concerns unless it might be medication induced. Oftentimes where it comes back to is just the relationship, really getting back to like making sure first of all, your mental health is good, making sure you are having opportunity to date one another, to rekindle that intimacy. Because remember we talked about intimacy is not just sex. So we have had conversations, and a lot of times they say, yeah, I realize that we've kind of gotten to a status quo where it's all about the kids and we're not even like, regarding each other. And so that's probably why the sex has kind of gone down, because we haven't even been feeding our own relationship. I feel like that comes up, I think, a lot more, but I do have patients where there's concern for abuse. But I think that's why I think the conversation around sex is important, because couples are dissatisfied in this area and don't necessarily know, they just think they have to deal with it. It's like, no, there's things that we can do to work on that. And it's and that's just as relevant as everything else I'm talking to you about.
Interesting. This is a well-needed conversation. And as we come to a close, I want to say thank you.
You're welcome.
Thank you for your time. Thank you for sharing this plethora of information. I can see that you are well knowledgeable at what you do.
Amen.
And I can see that you're great at what you do. And I want to
Thank you.
commend you for, offering yourself to care for others or to have an eye out for others, that don't know. Like there are things that you've shared that are new to me or foreign to me. And so there's still room for me to learn when it comes on to sex and sex health.
Yes.
And so again, on behalf of A Way Out and the team, I want to truly, truly say we thank you for being here today.
You're so welcome. Thank you so much for inviting me.
Thank you.